from Health Force Minnesota, and we're just very happy to welcome you here for a special webinar that we have today on debriefing by Rose Raleigh. Before we begin, I just want to do a little bit of housekeeping. The first thing is that you are being put on mute as you come in, and we use the chat feature if you have questions. At the end of the session, we will have some opportunity for questions, so I'll be watching those and writing them down and then asking those at the end. One of the things that I would like to do is show you where you can get a handout for this presentation. In the chat area, I did put our website link, which is healthforceminnesota.org. If you go to area and way down to the bottom, you will see simulation curriculum. When you go, you are going to find the first link will be to our MnSHEP website. And this particular is actually one that MnSHEP has set up. MnSHEP is the Minnesota Simulation for Healthcare Education Partnerships, and we hope that you are a member of us. It's free and it is easy to join, and you get access to lots of different things. There will be a request for a password. The password is simulation with a capital S. So that's simulation with a capital S. And any sources that are in here, you are welcome to use. If you go up, you will see newsletters and webinars. Go into letters and webinars and find this particular presentation. This is all debriefing and simulation, setting the standard, and it is scheduled for 11 to 12:30, but we'll probably be closing it up by about 12:15 because Rose has a simulation at 12:30, so she needs to get ready for that. The regular presentation is intended to familiarize people with the NACSL standards, which are the national standards of simulation and normal methods of debriefing. Transitioning to debriefing along with effective and effective methods will be covered. Rose, our presenter, and Rose is a faculty member at Century College in White Bear Lake, Minnesota. That's a Minnesota Alliance for Nursing Education. You know that more familiarly as the main RN curriculum. Rose, 8 years of experience in simulation and has given presentations on simulations at the local and state level. She's a member of the 2016 NLN Leadership Development Program for Simulation Educators, and we're currently researching the merits of having a statewide simulation for educator and industry partners here in Minnesota. If you, right after the objectives for this presentation, you will see the handout for the presentation. You'll find this is going to be an Adobe PDF with 2 of her slides per page, and also the survey to complete after the presentation. I do want to show you one thing as far as this survey goes, because there's one part that gets a little confusing. So when you get done, go ahead and click on this, and I'll just be answering these 3 little questions. When you are done with that, there's a link right here, and I didn't have any way for actually making it link, so make sure that you copy and paste that into a new browser, and then you'll get the continuing education hours for this presentation. So with that, I do want you to know that we will record this and put it up in our website right in the Minnesota MnSHEP website for you to be able to use afterwards. If you have other people that would like to participate or view this. So at this point, I am going to have Rose, let's see, hold on just a second. I'm going to give you the presentership and I'll let you begin.
All right. Turn my a little bit. All right, so thank you so much, Sue, for me to share my thoughts, a little bit of insight on debriefing in simulation, and thanks especially to Minnesota for helping sponsoring me to be an NLN sim leader in the sim leader cohort. It's a great learning experience, and As people apply for it, the application did finish for this year, but perhaps 2018 you want to think about that. So I want to talk today about debriefing and simulation, setting the standard. The initial standards are key, obviously, to simulation. Though we are redoing them, and I thought the new revised ones would be in October, but I haven't seen those yet, so do keep an eye on those. And I know we do have a linked website for that as well. So I think when people think about debriefing they're never quite sure where to begin, and always going to the standard will guide you on how to prepare as well as what the expectations are. So I started simulation in 2008 with Carrie Dixon at Century Shoes at Inver. We had a joint program, and so we started our simulation program together. And I remember after our first sim, my debriefing was, great job, and on. I think just so relieved to have the simulation over. At that point, I didn't even think about, asking them or talking with them about what they learned. So the first, I talked the next day and said, we probably need to go a little bit deeper. So the next thing now is that we have so many more resources than we back in 2008. Some are free, some are not, but it's, there's just so much more now. So I have those resources as well today to get started. This is a picture I think this is how our mannequins debrief at week or the end of the day. A little relaxed, and I don't think our debriefing usually looks like that, but I like mannequins, the brief as well. So describe the criteria from the NACSL station standard, the debriefing process, just at least 2 methods of debriefing, and state at least 3 signs of effective debriefing. Again, going back to the beginning about what debriefing is, it's something that follows a simulation experience as led by a facilitator. Participants' reflective thinking is encouraged and feedback is provided regarding the participants' performance. Most aspects of the completed simulation are discussed. Participants are encouraged to explore emotions and question, reflect, and provide feedback to one another. The briefing is to move toward simulation and accommodation to learning to future situations. On what you're supposed to do or what the briefing is supposed to be about, it's not about new or a new skill. It's take what's happened during simulation and talk just about that. So it really is kind of the who, what, when, where, why, and how. If nothing else, you want to just start with those questions and walk through them with students. So I struggled with how to transition from our simulation to debriefing. It was a clear transition. I started with being in the same room as the participants. A number of people have. How do I transition from being the mannequin to now being Rose, the facilitator? So I found that before I would tell the students that when we're done with the action, I'm going to stand up and say end sim and move my arm. And I allow some safety, and I'll say it doesn't mean you did anything wrong. It's just that we're done with the action part of the sim. So whether you're in the room with them, you have some motion. If you're outside of the room, pre-brief, you're telling them, the mannequin, I'm going to say simulation's ended, or charge nurse comes in for a report, that's when the simulation ends. Give them sort of idea that there is a set point, that the action of the sim is ending, and that you move to debriefing. And again, that they didn't do anything wrong, but it's just time to debrief. In the beginning, I really didn't allow students to take that breath afterwards, whether the situation was really emergency or kind of a typical home care situation. I found they do in fact need that time to just take a breath, settle themselves, and transition from action to debriefing. I allow students to put away supplies. They need kind of that release time, and I found that for some students, they clean up like that because they usually put things away in the wrong spot. So I have just let them do that because some students really settle until they put everything away. And I'm in the same room. We don't have a standard debriefing spot, so I usually just debrief in the room. So students need to clean things and put them away. It gives them time to catch their breath, think about things, and a little release time just to a moment. So I've let that go and know that we're going to have to find where they put things, but that's okay. And that action is over. For students or kind of getting their thoughts, it's okay, now that the space is where it should be, let's just debrief. And you're kind of marking that moment, actions, when you're moving into that next phase. So brief, let's go back to the standard. There's in each standard, and then actual student debriefing process has criteria. It's facilitated by some competence in the process of debriefing. Now the is how do you know you're competent? That's a question. You know, you can go through the videos and go through course and training, but how do you really know? So I recommend having somebody come and watch you who is versed or an expert in simulation. So I'm having somebody come in next week who's a CHESI certified or T certified. I'm never quite sure how they say that. So the certification person, so I figure they know what they're doing. They can only debrief. Other people who aren't really familiar with simulation and the process of debriefing, you know, usually do a really good job just of teaching students, not allowing them to reflect, and it looks like you're doing a good job of teaching, but not facilitating. So, you know, again, we're still working on how to maintain or understand that competence. So conducted as well as an environment that supports confidentiality, trust, open communication, self-analysis, and reflection. So Jeannie talked about in pre-briefing, talking about setting that standard of safety and confidentiality. When I brief, I have one that says what happens in simulation stays in simulation. Go back to that during debrief and say, remember, we're still in simulation. What is said here stays here. By a person who observed the simulation experience. I know in schools that it kind of has become an assembly line. So persons are pre-briefs. One facilitates the action of the sim, and then a separate person debriefs. It's hard to do if you didn't see the participants in action. So, you know, a few people can share the roles, but really the person who's debriefing needs to see the action as well. It's a structured framework. We're going to talk about that later, about some researched debriefing processes, but you should have a method, a formal method of debriefing, how that is. So whether you have reflection questions written down ahead of time or from start to end, you should have a process in place for doing debriefing. It will actually make your life a lot easier. As well, I want to debrief and go back to the participants' objectives and outcomes of learning activity. So go kind of to the beginning of what was the purpose of the sim, did we meet the objectives? So we're just going to talk a little bit about some methods of debriefing. So there's quite a few out there, and there's going to be more and more. So the advocacy, inquiry, plus delta, on debriefing for meaningful learning, EML, analyze, summarize, or GAS, guide reflection. These are just a few that are just that have some good and descriptions out there. So we're going to start with plus delta, which is started once I figured I couldn't just say grab or grab and have that be it. It's very simple. If you've never had a structured form of debriefing, this is a very nice way to start. Can you bring a piece of paper, have a whiteboard in the room, and write it down so students can see. So you do 2 columns, or you're approaching it from 2 ways. Your plus is your positive actions and decisions. Delta is things that could have been done differently or better. I've done ways. We're on through. Let's first talk about all the good things that happened during them that you would repeat. And we go from start to finish that way. And then, okay, let's go back. What are all the things that we would want to do different this time the situation happens? So I know we get lost in that, so I've broken it down to kind of beginning, middle, and end of simulation. So I'll say let's start from the time you walked into the door to the time your first S-bar happened. What was the things that happened? What's behavior you'd repeat again? And then what things that could be done differently. I think depending on your group, it just helps them focus in those short chunks of time versus the whole simulation. But a pretty straightforward way to debrief. On to debriefing for meaningful learning, or DML. It's Christine, I think it's Dreyfus, I can never say her name, full system that she developed, and it really is based on that Socratic questioning. That facilitator, you don't give information or answer questions directly, and instead questions so participants can uncover through themselves. This is, I mean, I'm not well versed in the process. This is how I actually teach anyway. So a student say to me a few years ago, "Oh, so you teach by the Socratic method?" I said, "Oh, you think so? And that's great." So I really enjoy asking them questions, and I know it's frustrating for them and sometimes for me when I don't give them the answer directly, but again, it's all about working their thinking so they think like a nurse. I tell them it's about what I know. It's about helping you think to what's happening. A few different ways she has three focuses. So it's reflect, action, happened, inaction, and beyond action. The kind of a theme a lot of debriefing methods is it's not just about today in this room. It's really about what's going to happen the next time you take care of a patient like this, someone who's similar to this. And I to help students if they've made a mistake. Again, it's better to make a mistake here than in practice. But so ML, the focus on 3 things, and she gets by using there's 6 phases. So it's engaging, exploring, explaining, elaborating, evaluating, and extending. That engaging is to unload. So that's that moment that students take that breath. And the process is they actually write down things at the time. Just quiet self-reflection period. So just take breath, have a moment, and put thoughts on paper. And then actually moves on to exploring, where you map the care of the person. And it's great when in pre-briefing, some people use concept maps. So you could bring that concept map from your pre-brief and this phase of DML and look to see, your main concept map and add to that. And then the phase is uncovering the thinking behind the action. So it's using those phrases like, I noticed that when you gave that albuterol, to inhale, deeply using that, tell me what you were thinking when you were having them use that inhaler. So again, asking those questions or those statements to their thoughts. And that rating, it's going to a greater depth. So we're teaching them new things, but go even deeper to what they're thinking what could happen. And evaluate didn't go well, and again, it's so the next time this happens, what would you do the same? What would you do different? To go back to that, she's got a good article in clinical simulation and nursing. She's done a lot with this, so you can find her information. I put her reference on here as well to that article. Just gather, analyze, summarize, or guess. I tend to do this one quite a bit as well to gather the information. So just recount what you want to analyze. So what happened and why part. So I noticed you gave the adjuvant before the albuterol. Tell me what you were thinking about that and reinforce that learning. So the next time this happens, what would you do the same and what would you do different? And actually end up, so what's the one thing you're going to do the same? You did well that you're going to do the next time you leave. So I do try to leave them or leave on a positive note. This 2-1 method, I tend to break the scenario down into beginning and end. Sometimes I find I actually have to break it down into smaller chunks. There's so much that went well or not so well that we really as a group to walk through and talk about where there may have been some misconceptions or previous experience. And I find things that they see nurses do certain things in practice, but necessarily the state, and that leads students or participants to repeat those basically mistakes. So a lot of that tends to get fleshed out in debriefing as well, but that's why I've learned just sometimes in smaller chunks, it works better. And then at the end, kind of sum it up. As well. So now some methods to debrief. I touch base on some debriefing. You strive to have participants talk more than that facilitator. And of course, these will be ineffective in debriefing, but it's really their time to do your thinking, their judgment, and for them to say things out loud and put the pieces together more than us thinking about what we know. Another really thing to do is wait time. I have a background as a secondary science teacher. And one thing when I was getting my theory ed certificate, when I had education courses, they talked a great deal about wait time. So I learned 3 to 5 seconds. Other people have said 5 to 7. This was the reason I didn't necessarily like students to clean up. So, some time to think, I would just put a few things away. And I would, so just while you're thinking, I'm just going to take this IV tubing down. Be okay with silence. And usually they'll start talking. So give them access and talk. Silence is okay. I note, I actually used this with my patients when I was in practice. Things as soon as you say patient, you have questions, and then you leave the room, and 5 minutes later their call light's on. I actually learned to say to the patients, "Do you have questions? Well, I'm just going to tidy up in here for a few seconds before I walk away." And within that time, they had a question that I could answer, and you have to get called back. So wait time's pretty good for just about any pod you're working with. So again, briefing, ask questions or use the statements without thinking from the participant. So go ahead to that Socratic method, or again, having questions down they like to ask that you think are global questions or questions specific to the relation of area want to be addressed. It's basic therapeutic communication. Avoid yes/no questions. Use open-ended questions, things like that. Make sure there's an adequate time for a full debrief. Another piece that really took a while to get the right set. Every simulation or every simulation is a little bit different. So it really took me a while to figure out, Carrie and I, to figure out the structure of time and how to make sure we had plenty of time for a full debrief. So structure my time with half-hour pre-brief. We do quite a few things in our pre-brief and then post-brief, but a half hour for pre-brief. We do an hour for the sim. It's some a little bit longer depending on how things are going. 30 to 45 minutes for a debrief. And that to work pretty well for most simulations. But you want to give the time to really process and put where you think the learning occurred and where you think obviously the learning occurred as well. That's the biggest challenges, I think, for people who are new to simulation is just that timing of the sim. I had a discussion about, to have equal time to the action of the sim. Is your briefing 2 or 3 times longer than your actual sim? It does depend on what are your objectives. When you're pre-brief, and I think your proficiency in debriefing as well. So nothing standard, but just allow time for debriefing. That does take some work. And I'm never sure if am I doing what I should be doing? Get some out, but again, go back to the standards. Nothing else, am I meeting the criteria that the standard set for me from the NACSL standard? So debriefing, I could book about what not to do. So great job. So as teachers, we try to, it's about we know and how they should think, and that for me, becoming a facilitator. So I taught in the classroom. So the less I say, the better I actually learn. So as that facilitator, we're going to avoid saying this is what I saw without allowing students to say anything. Sometimes we get trapped that we want to be the ones to say what went well and what went wrong. So we actually say everything that happened and what changes could be made. And that's really not the purpose of briefing. So avoid if you find yourself talking more than the students, as I part, you just want to back off and, even just say, let's just take a moment and think about where we are and where we need to go from here. Something to give yourself time to process and pull back. And of this is that students really want to know your opinion about how they did. Well, but how do you think? How we did. Response to that is always, but not about how I think you did. It's about what you learned and what you're going to do the same and different next time. So it bugs them, but eventually they get it. Eventually get it, but it really take time. If I do tell them at the beginning, if I see what happens in simulation stays in simulation. If I see anything that's going to be a safety issue or that's a safety issue, then we'll talk to clinical instructor, but I will let them know ahead of time as well. So I want that safety, but they need to know that if they're not getting things, that they might need to come back and repeat the sim. They might need to do some remediation. So again, another thing that if they're not understanding that the family asked them why giving that much medication and they didn't take that cue, something needs to be done. So a conversation with people, I will pull them aside afterwards and have that conversation. If they really think they need some even if they need to be told how they did. We're letting them process and figure things out. Also, this is the time to lecture. So if you have that desire to stand in front of the group, say, well, here's everything you need to know about strokes. and write things on board. And again, you're the one talking. I need to do to remind yourself, wait a second, I'm a facilitator, I'm a teacher, I'm not a lecturer. So again, it's not about teaching them anything new, it's reflecting on what happened during the action. An effective debriefing where there's no transition time, especially with students who are new to SIM, we tend to cue them, or some will take time out and talk what's going on, and then we never quite time back in, and sometimes get lost in, well, is the SIM done? Are we debriefing? Where are we at? So again, give them time to transition for each period of the simulation, and just so that they're sure where they're supposed to be. And again, facilitator talking more than the participants, and really just dying right now because I can't see any questions or see anybody, and I just ask you guys questions and facilitate conversation and having people laugh. That's the downside of facilitator. And to have, let's go back to effective debriefing. So going back to those objectives. So did we meet objectives of the simulation? Again, this is not time to bring new concept. So never heard about, let's say, blood transfusion. It should not be built into the simulation if they're supposed to do it and they've never done it. But now is the time to teach them about blood transfusions if they've never learned about it. You can read that if it's something they saw on clinical. Again, kind of as DML talks about, just going a little bit deeper and tying it to practice. But you really shouldn't have the opportunity to teach them new content. One slide missing from that I should have done is time as a new person, time to debrief the debriefer. So I feel very lucky that I was doing this with someone who was also new to simulation, and we had some people who were more experienced who we had met and bounced ideas off of, but then was able to debrief each other and have those people talk through, well, next time you ask them the question this way or say this statement. So that's nice. So what I've learned is that, it's good to reach out to people who are new to simulation. So how did it go? What was your objective? Was it just to support them in that? And I think just for me, sometimes I need to be debriefed as the debriefer. Was like, God, what should be different next time? So I found out when the simulation is not going well, on my end, where I created or poorly into simulation, or how the students are not connecting the pieces that I know they learned in the classroom to having an active patient, that it's nice to have somebody to bounce ideas off, say, okay, here's what I did, here's what I was thinking when I set it up, here's what I learned in theory, what I need to change to make this better, because what I'm doing now, something's not working and I'm not quite sure where to go. So you have that person, whether you're experienced or novice, that you have that person to bounce ideas off. And it's okay that we make mistakes as facilitators. I think one of the mistakes is that we put touch in the simulation and expect students to do things in the same time frame we do. So I had to take that moment to say, was I expecting too much from them? Right, they're only first semester students. I have to remember that. So I debrief. The facilitator needs to be debriefed well. I apologize, it's not on your handout, but this is the other day about what I include. There's who are very good about giving me feedback. We'll say it actually was a great idea. So there's some thought about debriefing, reflective debriefing, whether you have students do it at the present or you have them sit on it for a while and write a reflection. I've done that as well. Maybe one day I was really sick and I just couldn't breathe. The students to, by next day, send me a page reflection of the simulation. And I have them, and it was it's probably been 6 years, but I took away from it. They were able to write down, but also they're able to keep that and reflect on that DML, that, she them write things down to, hold on to for future learning. And there is benefit to that. Students now, some of the students, interesting, when they need, they'll tell you what they need, and then document like an event note after each sim. And some of them saying, I feel the need to actually write down what I learned. Fantastic. And some of their reflections have been just amazing. This student came to me, debriefing, this nursing student around came to me and said, after first sim this year, I think I'm missing out. And the students they're very good. They tell me about not sharing what happens in the sim with each other from group to group. So I do one sim with 12 to 13 groups. And, I just think, though, even though the sim's kind of the same, I think students have different thoughts and ideas about what they learned and what they're going to carry forward. And she think I'm missing out by not debriefing everybody. Okay, what are you thinking? And so she had the idea of doing grand rounds with a simulation patient. She knew about grand rounds, in the hospital, generally with those patients that are a little more complex, or maybe things didn't go so well, or just a very interesting case. And she says, well, everybody's done. Can we debrief as a group? Sure, okay. That's really interesting to do. So, her and one of her peers, they did this as an under project. So they dug into the literature, which they couldn't find anything on nursing student grand rounds based on relation patient. But they looked at nursing grand rounds, nursing students who presented at grand rounds on a patient, not based on the simulation patient. So we did our first nursing student grand rounds 2 weeks after everybody had completed the first sim. I was a little hesitant because I said, just the timing worked out of tests and things like that. And I said, really, is this you guys going to forget? And she said, no, actually, I think it's better because we're going to be thinking about it. 29, it was not mandatory by any means. It was voluntary. It was during an hour between classes. And I had 29 people show up. And I thought, oh my gosh, are you kidding me? And I came into the room, in the classroom, and kind of, again, started from the beginning. We walked through the scenario. So I walked through the scenario about what happened, and went back and started from the beginning, debriefed. And what was interesting is I could tell they'd been thinking about it, and they had some really good thoughts and ideas about this. So one thing I didn't do is I didn't set safety to the nursing student grand rounds. And that thing, well, in my sim, this happened, and I did this, and somebody did this, and so I learned that the next time we did this, I kind of blanket statement. Now, again, we're going to be safe. What happened, simulation, even in this room. But if you want to bring up that happened during your simulation, just say, so what happened if someone did X or Z? Because those conversations happened as well. But the students doing this as honor projects they had dug a little bit deeper, came with some deeper questions, and we briefed as a large group, and it's been phenomenal. We've done 3 so far. It's probably been about 45 minutes. Our sim is a triage sim, and we take an hour and a half and do nursing student grand rounds. So there is value. I find that there is value of let's digest it and come back. And I know you too have had the experience where students back to you on an individual basis a week or 2 later, even say, I was thinking about that sim, and I wish I would have done, or I'm really glad I did this because then the next week in clinical, this is what I did. So there's something about revisiting and doing debriefing or reading or however we would call it later. Surprised me how well this worked. I've just done it with one semester, but I think next semester I will do it with both groups of students that I work with. So yeah, they're actually making them do a abstract to submit to a conference, and maybe they can do a poster presentation on this. But great idea, and as that instructor, and again, it's just reinforcing that information that I want students to come away with. So in conclusion, debriefing, it's an important part of simulation. Adequate time. Now, everybody says it's the most important part of simulation. It's one of the parts, but we do know that learning occurs. But this is debriefing really is the point to bring it together. Some people say simulation is just the point of debriefing. So, but really do need that adequate time to do that. Don't be afraid to use participant observers to aid in debriefing. I really enjoy having participant observers. I on the clipboard, they have specific things they're going to watch for, or write down the flow of events, phrase that worked well, phrase that, maybe next time we would avoid using. And I will have them lead the debriefing. Again, with drills with them. And this is your professional role. You're to let your peers in a professional manner. To get too nitpicky, I will redirect them. So, then, because obviously for students to learn, participants to learn, give feedback to each other it's a skill, and some of them get really, really good at that. Again, follow a structured approach. Be sure areas needed to be covered are covered. Usually make a list of things that I'm pretty sure students will do well or won't, and make sure that they are addressed. And I also keep sharing with them aha moments of, that was a great question, or they're like, oh, why did they do that? And goes down, and I'll make sure that we get back to those. Evaluate yourself. I learned to tape myself, so evaluate debriefing by taping yourself or having a peer come in, give you feedback as well. I think we need to continue to learn and grow, and how do we become better without how are using our own reflection and debriefing to look at our change in our process. What I know, some of the things I've learned about debriefing, it's sometimes been a very painful process when you don't do it well and you know you don't do it well. But I've learned that students are very forgiving when you try to get a really good learning experience. So sometimes I'm very hard on myself, more than they are. If there's any questions.
Rose, I just want to thank you so much. You gave us so many practical applications. I'm just astounded by this. It was just great. So if you have any questions, please type them in and I'll ask Rose, or you can raise your hand and I can unmute you if you'd like, if you prefer that. Just questions for you though, Rose, that perhaps you can answer. One thing that you mentioned was that CASE certified person who might come in and observe you. What's that all about? Can you explain that a little bit?
Yep. I want feedback on how I'm doing as a simulation facilitator. So after being at some conferences and my sim lead group is, how do we get good feedback? How do we know it's good feedback? It should come from somebody who knows simulation and understands that role of facilitator and debriefing. So kind of my thought for MnSHEP as a rule, so Molly Curran is now working on LN, but did sim at St. Kate's for a while and is certified. She's CHESI certified. So I just asked her if she would come in and watch me and give me some feedback. I think that I told students that we're going to have here's why, and I think they were pretty I hate to impress, but I tell them I want to get better too, much as, we give you feedback. So that's what I'm doing. So I think it would be interesting. I don't know who in the state is side, but if we had a group who was, or some people who are willing to, um, not go far, but could we send them a video and have them give us some input or some critique about what did we do well and what could we change to be better facilitators? So I'm somebody who I would see as an expert in simulation. Come and watch me and give me some feedback.
A very, very interesting thought, and that's something that we may need to look into further with the MnSHEP group. It might be a very nice opportunity just to allow people to have an access to those people who would be willing to do something like that. I like the idea of just videotaping and sending it in, because that makes it easier on both participants. Very interesting idea. Thank you. Questions. You were a beginner in simulation, and there's really 3 different simulation debriefing methods. What do you use? And also, it almost seemed like some of them you were using multiple debriefing methods. Do you do things standardized? How do you put all that together?
Good question. So if you're new in simulation, I truly would start out with the plus delta briefing method, because it is so straightforward. It's what went well, what would we do different next time? And so my debriefing is, for the most part, again, to break it into segments. So let's start from the beginning. Walked into the room. What was your greatest concern, and what were the actions that you took? And start that way. So well, in that time, what would you do different next time? And then on to like the next section. I have each of them broken into pieces. How I move through that. So kind of a mix of plus delta and gather, analyze, and summarize right now.
Okay. Another question. We were, before we started this recording, that you have students at times that have blamed the mannequin for their poor performance. Could you expound on that and how you handled that?
Yeah. I just had that last week where the silly didn't go very well, and the students knew it. I mean, they knew it. And when briefing, they said, but if it was a real patient, I would have done better. It was a patient who was having a COPD exacerbation, and they just saying, I can't breathe, and the sats are dropping. And I bring it back to, if you can do it on a person, but if you've seen a person in true respiratory distress, you move any faster. Frequently, new people freeze because they don't do, and I just remember as a new grad, I panicked and goodness yelled for help. But so I bring it back to, if you can, you'll do it on a patient. Have you had a patient like this before? It is hard to know what you're going to do if you've experienced before. And then I was able to say, that thing, because last simulation, you managed everything very effectively with the mannequin. So what changed between now and then? There's a few different areas. I will bring it back to them and say that. Yeah.
Oh no.
I guess I try to. They want to blame the man or they're something for inadequacies, and I just bring it back to, it's about today. It's about next time. So do different next time. Now that you know, we do different next time. So I try to even get out of this arena about, I think that's okay. Better to learn here than in real life.
We have other question, and it is, how can observers be used effectively in debriefing?
Yeah. So I found the best way from speaking with us is that they have specific things they're looking for, whether it's safety, communication, whether you're giving them the objectives and having them write down what objectives were met, simulation. What else have I done? Oh, like what was the priority, kind of the nursing process? What did the nurse do? Did it work? What did they have? So I find if they have certain things they're looking for, that writing them down, it's effective than if you're just having them write down thoughts. And they can do that as well. And then figure out how you want to use them in your debriefing. Do you want them to, did you give them questions where they can lead the debriefing? Or there's going to be a certain part where we met, at the end where we met the objectives, so they're kind of summarizing how the objectives are met. Again, I found the best way is to have that structured somehow.
Okay. Then do you give them some type of a handout to look at that?
Yep. You have questions for them. They get a clipboard, and they're supposed to fill it as we go along.
Interesting. Thank you.
Well, the piece of that, just to follow up, is that the book now has said that, for our rules that, they should all be nurses to count as clinical time, but there's been some pretty strong research that says participants have learned more. The observers learn more than nurses because they don't feel the pressure of being that nurse, and they can sit back and see the whole picture and put the pieces together. So there's actually some really good learning. Now, of course, it's not just the sim where we're learning, but that debriefing is the main part. So I have students who actually have extra to be observers because they found it to be so valuable.
I'm glad that you mentioned that, Rose. And Marilyn, if you are available to talk, I can put you off of mute. We had a discussion yesterday. The Board of Nursing was talking to the Education Division of the board to find what the role of the nursing is, and they told them to go back to the Nurse Practice Act to see what the role is. And Mary, if you are available that you can comment on that, we'd really appreciate hearing from you.
Me?
Mm-hmm.
Oh, yeah, it's interesting that she said that because it was a discussion that we had this week. Our education committee met on Monday and asked their input for how do you clarify the role of the nurse. And one of the members said, we're not prescriptive. You go back to the Practice Act. The Practice Act is not prescriptive. It says assessment, it says, attention to safety and so forth. And all of a sudden it made such sense, and it really is aligned with what you just said, Rose, because are different aspects then that you are truly performing nursing, whether at the practical nursing level or the professional nursing level. And it really came together, and as we're preparing for the the simulation conference, like Kelvin said, I feel so much better because it makes so much sense, and it truly is consistent with our Nurse Practice Act.
And just an FYI, we are planning a 2-day workshop here in the Twin Cities for May 17th and 18th. So we'll be getting more information out to you as that is available. But just save the date for May 17th and 18th, the 2-day workshop right here in the cities. We'll be beginning it with the Board of Nursing going over the new standards for education partners, but then really looking at best standards in simulation, similar to what was doing today, looking at those NAACL standards and how can we facilitate the use of those within our nursing programs or in industry for those who do at the industry set. What other questions? And if there's anyone else that has questions, please come in the chat. And this is the question that I had someone do if comes up during debriefing. For example, they're in the debriefing and they remember a situation that they personally were involved in. Can you kind of explain how you deal with that?
So I'm just going to repeat your question because you cut out a little bit for me. So this is the students that have the same experience as
Yes.
the sim? Okay. So I've had that a number of times, and sometimes you know the situation of the student and that you try to have time say, are you okay being a nurse? Would you rather be an observer? Do you just but I've had students that have broken in the middle of the sim as the nurse, and they've looked at me and I said, just leave the room, and they've always come back. So, you know, of course, watching your students and the impact that, or the participants and the impact that the experience is having on them, it could have that personal piece to just make them think. I have one student who kind of froze in the middle of a sim, and after I said, what happened, she said, I just realized what it means to be a nurse and how much responsibility that is. It's like, well, good. So, you know, so that was a great debrief. I mean, that led us to a great conversation during debriefing. Just being able to, again, having that safe place that if, you know, at some point you need to leave, and just come back whenever you're ready. And students have left and back and shared their personal experience, or left and didn't come back but came to me later, or emailed me and talked to me later about what happened and why this just brought everything back. And so, again, we sometimes know the stories of our students, but not always. So you're never quite sure what's going to set somebody off, whether it's a personal experience or, you know, something else that's going on.
Okay, thank you so much. We don't have any other questions, but I do want to bring you up to the website to show you where you can do your survey. And also, I want to tell you about the next webinar that we have. And Rose, do you tell them a little bit about this as I'm getting to the website, because you are going to be doing this, I believe, with, is it Colin that you're doing this with?
Yeah, that's a good question, Sue. So we're doing it about facilitation, so debriefing, facilitating the simulation. So our currently the same small group for the sim leader cohort, and I've been looking at effective facilitation from the sim or the setup of the sim to debriefing, and so going to go back to the standards and look at there's a facilitator and facilitation standard, which if the new standards come out, they're going to be combined, but we're actually going to take the facilitation or facilitator standard through that and talk about effective facilitation from the beginning of the sim to the end of the sim, quality are, and again, what's the role of the facilitator.
Okay, and I just pulled this up on our website, and that's Tuesday, December 13th from 10 to 11:30. And the Rose and also Dr. Colleen Royal from Minnesota State University in Mankato will be presenting on that one. We have the information on both of them, their objectives, and also the WebEx connection up here on our website under the MnSHEP. For those who are on are looking today to do the survey and get some a certificate for attendance, that's up here as well. Just go to this link, and I showed this at the very beginning, but I'll show it to you again. You'll come up to this survey. When you are done with the survey, you'll need to copy and paste this into a new web browser to actually be able to download the certificate. So I want to make sure that you knew about that. The other thing
Sue,
is to be, go ahead.
Oh, I can only see my screen still. Did you bring it back to your screen?
I didn't. Thank you for telling me that. Okay, here we go. I'll show you that again then. Okay. So let me show you again up on our website where that is. It's up, of course, Minnesota website, and you go into that curriculum and then simulation. Is simulation with a capital S. And down here on the newsletters and webinars, you find the webinars, the information from today's webinar. Bottom here is the survey to take, and get done with the survey. Just make sure that you copy and paste the link into a new browser and be able to download that certificate for attendance. All down a little bit further here is the information for our next one, which will be Tuesday, December 13th, setting the stage for success as a facilitator. Information for on Dr. Holly Royal and also Rose Raleigh, and our WebEx link for this as well. So the following in the spring, I've got the archives as well from our other ones that we have done this past year up on this website as well. In the spring, we are going to be having one on transition to practice by Dr. Molly Kellgren, and she is now working for the FN. We're also having one on pedagogy with Dr. Reed and I believe it was Gail Johnson from industry. So just aware that we've got some more coming up. Another thing I want you just to be aware of and to be looking and using our resources up here on our MnSHEP website. We've got a different simulations in here that you are very welcome to use and tweak to your own needs for your own program. Some are directly with the LN ACES. Some of them are ones that have been developed within the state. So these here we have, and if we can help you through MnSHEP in any way, please let us know. If you are a member of our MnSHEP listserv, please open up the survey, and at the very top is a link to our listserv. And please go in there and get up to our listserv so you can make sure that you're getting updates on things. We certainly thank you so much, Rose, for your time today. It's been wonderful hearing what you have to offer us with your practical application of debriefing and simulation at your facility. Very much. Last word.
Now, again, if people have questions or want to, I'm happy to help.
Oh, thank you so much. And Rose is at Century College, and if you need her email, I'll just email me at Health Force Minnesota, and I can certainly help you as well. So thank you very much for your time, and I hope that you all have a nice day. Some of you are in the midst of a blizzard. Others may get a blizzard later today, so enjoy our first weather incident. Until next time, talk to you later.